The Southwest Center for Pediatric Environmental Health is one of the 10 pediatric environmental health specialty units, also known as PEHSUs, in the U.S. The purpose of the PEHSU program is to serve as a leading national source of medical information and consultative advice on environmental conditions that influence human health throughout reproduction and pediatric development. The PEHSUs serve health professionals, community organizations, government officials, federal staff, childcare providers, parents, and others having interest in environmental conditions that influence pediatric health. Flooding is the most common environmental hazard worldwide, whether from rivers overflowing, hurricanes, or massive rainfall. Flooding can have devastating effects on people, homes, and communities. Precautions taken to avoid and deal with environmental hazards associated with a flooding event lead to safer health outcomes for the entire family.
Preparedness for disasters is necessary no matter where you live. Some areas are more prone to floods and hurricanes. Some are more prone to fires like forest fires or ground fires. Some are more at risk of earthquakes. But no matter where you go, there's a risk of a disaster. It may just be a house fire. But preparation for these kinds of things is extraordinarily important.
Different environmental hazards may be encountered after flooding, such as contaminated floodwater, hidden debris in floodwater, structural damage to homes, mold, displaced animals, extreme heat, and carbon monoxide poisoning.
The acute hazards, drowning is the first risk, the greatest risk. And this not only occurs when people themselves get into fast-moving water, but also when people try to drive their vehicles into fast-moving streams or streets that have been covered with water, thinking that because they have an SUV or a big vehicle that it will go through the water without any problem. And they frequently get pulled off the road into ravines and other places, and people drown because they can't get out of their vehicles in time to avoid it. The other acute dangers include infections. The water is highly contaminated in some cases with not only water from the rain or whatever led to the flood, but also sewage that may be picked up on the way, as well as hazardous chemicals. There are also a number of physical hazards associated acutely with floodwaters, including lacerations and abrasions, puncture wounds caused by shards of glass, pieces of metal, or wood, and these can injure the skin.
If the contaminated water comes into contact with your skin, especially if that skin is broken from a cut or a scrape, then you may be at risk for skin infections. Some signs and symptoms of a skin infection would be pain, redness, swelling, and we would really become very concerned if you have red streaking up your arm or develop a fever. If that were to happen, then you would need to see your doctor right away because you probably would need antibiotics.
It's important to note that not only private water wells can become contaminated by flooding, there are municipal sewage facilities. If they are overflowing because of flood water, the drinking water can become contaminated. And so even those who are on municipal water need to make sure that the city has tested the water after the flood and that it is safe to drink, and not drink the water or use the water for cooking until it's been cleared by the municipality.
Flood dangers do not end when the water begins to recede. Residents may be eager to return home after evacuation. It's not recommended to return to flood homes until authorities indicate it is safe to do so. Even if it's okay to return, stay out of buildings if flood water remains around the building. Children, pregnant women, and the elderly should not return until cleanup is finished. When entering buildings, use extreme caution. The structure of the buildings should be assessed. People should not be cleaning with shorts, t-shirts, and flip-flops. It's important to put on personal protective equipment to protect eyes, nose, mouth, and skin. That means long sleeves and pants, goggles, sturdy shoes, and an N95 mask if possible. Mold growth is common in warm and humid environments. This is especially true after a flooding event. To keep mold in check, the problem should be tackled within 24 to 48 hours. If you're not able to dry your home within 24 to 48 hours, you should assume you have mold growth. All porous items such as carpets, stuffed animals, and drywall that have been wet for more than 48 hours should be removed and discarded. These items cannot be thoroughly cleaned or dried and can remain a source of mold growth.
Cleaning up mold, you really should not try to clean up an area more than about 3 by 3 or about 10 square feet according to the EPA. If you go beyond that, you need to refer to EPA guidelines about repairing large areas of mold, and in many cases that means hiring a contractor who is an expert at mold removal and remediation, and to have them come in and do the job to avoid anyone getting sick.
Mold exposure can cause symptoms in some people, especially people who have underlying lung conditions such as asthma or COPD. For them, mold can cause exacerbations, including coughing or breathing trouble. Usually these symptoms will respond to the usual inhaler treatment. Other people who have seasonal allergies, they might find that their allergy symptoms becomes more severe around mold, such as watery eyes, runny nose, sneezing, cough, that sort of thing. And so we do recommend antihistamines if you're having that type of reaction to the mold. If your loved one suffers from asthma and experiences an asthma attack, then they should try using their albuterol inhaler at home. If they have no relief after 2 to 4 puffs from their albuterol inhaler, then it's very important that they see a doctor right away.
Children should be warned not to approach any animals, whether wild or presumed tame, because even household pets can be confused by or disoriented by the displacement from their usual home. And so they may be aggressive or fearful of anybody who approaches them. And so to avoid bites and any kind of a problem with the dogs that have been let loose by the waters or separated from their owners, it's best to tell kids just to stay away from them, and certainly not to touch any wild animal or anything that moves that they're not familiar with. As far as snakes are concerned, they typically live in burrows or dens, and with being displaced from their usual habitat, they will seek shelter under tarpaulins or under firewood or under a log. And so if you have to move materials like those things, you really need to use a long handled tool like a shovel or a rake or a hoe or something else to lift up tarps to move logs and pieces of wood to avoid getting bitten on the hand or arm. The same is true to a lesser extent for things like spiders. Black widow spiders will also set up nests underneath tarps and in covered areas. So to avoid stings and bites, it's best to handle those kind of materials with a long handled tool.
Mosquitoes will lay their eggs in stagnant water, something that will be in abundance during and after a storm. To combat these problems, you need to sweep your property and remove trapped water. That means turning over, covering, or throwing away items that hold water like tires, buckets, planters, toys, pools, and bird baths.
So in the United States, West Nile virus is the mosquito-borne illness that we worry about the most. The good news is that 80% of people are actually asymptomatic from this infection, but 20% of people can develop signs and symptoms. Usually they're mild to moderate, such as fever, headache, nausea, vomiting, diarrhea, and sometimes a skin rash. But the important thing to know about West Nile virus is that a very small number of people can get a very serious infection in their brain called meningitis or encephalitis, and this can be deadly.
Flooding will bring unwanted pests and insects. The use of pesticides should be the last resort method when no alternative measures are practical. Other methods include sealing hiding locations and entrances into the building, removing food and water sources, and using traps. If pesticides are used, children and pets should not be around.
First of all, if you're going to have to use pesticides, you need to make sure that you're using a pesticide that's adapted to the use that you're intending. EPA regulates and registers pesticides and where they can be used and for what purpose. So you need to make sure that you're using the right pesticide for the right issues. Second of all, if you're going to have pesticides that you have available to you at your home, you need to make sure that you can keep them out of the reach of children, because if pesticides are left open or left near a child, they can down enough to cause significant problems in only seconds. So if you're using pesticides, you need to be on top of them and make sure that they're out of the reach of your children. They should be stored in the original container whenever possible and should never be stored in a Coke bottle or a juice container or anything that looks like it might contain food or beverage. It should never be stored in a refrigerator or in a kitchen cabinet where it might be confused for food.
Floods often occur during the warm weather summer months, and so exposure to extreme heat can become a danger because of the loss of electricity from downed power lines. So it's very important to especially protect children and elderly people from the effects of extreme heat. Some of these effects can include at first sweating and just feeling hot, flushing, redness of the skin, but eventually as someone becomes more ill from extreme heat, they may stop sweating, they may not act like themselves, they may have a fever. If any of these things happen, then you need to call 911 and get to an emergency department right away.
First of all, you should try to wear clothing that covers most of your body. You want to wear a hat when you're outside to avoid sun. The head is responsible for a great deal of transmission of heat. You also want to cover your arms and legs. So again, long sleeve shirts and long pants actually help to prevent direct exposure to the sun, which will increase the heat absorption. It's very important to drink plenty of fluids when you're out in the sun and you're sweating. If you don't keep up with your fluids that you're losing through sweat, you can move from an area of dehydration to a risk of heat stroke in a relatively short period of time.
When someone has diarrheal illness, especially a child or an elderly person, we're particularly concerned about dehydration. So some signs and symptoms to watch out for if your loved one is dehydrated would be if they start to feel weak or dizzy, especially when they go from a sitting to a standing position, if they have dry or cracked lips. Sometimes children will get a sunken appearing look around their eyes, or they may just be very tired compared to their normal selves. If you suspect that your loved one is suffering from severe dehydration, if they're able to take fluids orally, then you want to focus on really encouraging them to hydrate with clear fluids or electrolyte solutions. If they're unable to drink fluids because of vomiting or because maybe they're confused, then we want you to call 911 and go to the emergency department to get IV fluids and a full evaluation.
The risk to health from carbon monoxide may continue over extended periods of time after flooding and during different stages of disaster recovery. It's primarily associated with power loss. The indoor use of portable generators and outdoor grills can lead to carbon monoxide poisoning. To prevent carbon monoxide poisoning, always use a generator outdoors and at least 20 feet from the window or doors. Be careful that any power cords running from the generators do not sit in water. Never use outdoor grills or cooking devices indoors. Every home should have at least one working carbon monoxide detector. The detector batteries should be checked at least twice annually. The most common symptoms of carbon monoxide poisoning are headache, dizziness, upset stomach, vomiting, chest pain, generalized weakness, and confusion.
While disasters cannot be prevented, the aftermath and disruption caused by flooding can be minimized with preemptive planning and careful consideration of environmental hazards. For more information on PEHSU, please visit PEHSU.net.